Hello, welcome everyone to this WIN webinar entitled Funding Opportunities for Women's Health Research. I am one of the moderators for today's webinar. My name is Karen Hecht, and I'm the co-chair for the Science Committee's Webinar and Programming Committee, together with Mariko. Hi, Mariko.
Hi, Karen, and hello, everyone, or good morning or good afternoon to you. I'm Mariko Hill, and I'm the Global Innovation Manager of GenCore, and I will be co-chairing alongside Karen in today's webinar. I will be coming back towards the end of the webinar, though, doing the question and answers, along with the concluding remarks. So I'll see you all then.
Great, thank you for that, Mariko. So today I'd like to start by introducing Women in Nutraceuticals. For those of you who are new to our webinar series and our organization, our vision and mission is to achieve economic and societal equity to change the global nutraceutical industry and to empower women in nutraceuticals to unlock their personal and professional potential. You'll see that there are both men and women in this picture. All are welcome to join this organization and support women in the nutraceutical industry as we work together to achieve our goals. So WIN is a rather new organization, but we have made great strides in the time since our founding in 2022, at which time we launched the board of directors. And in 1 year, by 2023, we amassed 25 sponsors, 24 partners, and 441 members. As of this moment in 2024, we have approximately 500 members, 91 volunteers, 7 committees, and over 4,000 LinkedIn followers. So we really thank you for joining us today and for your participation, and we look forward to more growth together. We feel that we can really make a difference together to increase the number of women on corporate boards, leading in C-suites, and serving in executive leadership. Also in expanding investment opportunities for women-owned businesses and ensuring the growth of women in science and women's health research across the nutraceutical industries. And our overall goal is to ensure better opportunities for rising female leaders. And again, we don't want to remain siloed in this effort, and so we really do want to bring everyone together to make this a good effort and a successful one, fruitful for all. Okay, thank you. So that is the overall effort for WIN. And within the WIN Science Committee, our objectives are within that umbrella, focused on advancing women in industry, preparing specifically female scientists of different areas of industry, including corporate, academia. We want to prepare them for leadership and C-suite and board position, as well as fill the company pipelines with female scientists to close that gender gap at management level and to improve company profitability, employee satisfaction, and loyalty, and to attract and maintain talent. So advancing science on women is another very important goal. We want to change the way that research is done by including more female principal investigators to close the data gap and help develop products better tailored for women. So right now, WIN is hosting the WIN Awards and accepting nominations until July 12th. That deadline has been extended, and we strongly encourage you to submit your nomination as soon as possible. We are accepting nominations for champions in gender equity, research innovation, which is a particular interest to this audience here today, as well as in mentorship and excellence in nutraceuticals. So please go ahead and make sure that you get your voice heard and get your champion nominated. A few housekeeping items for today's webinar. This webinar is live currently, but will be available on demand, and we will have a Q&A chat box. So any questions that you want to ask for our panelists, please direct them to the Q&A chat box specifically. There's also a separate chat box that you can use to engage, but also in case you have any technical issues, our technical lead will assist you and respond through the chat box. Okay, so with that, I would like to introduce our panelists, and I'll ask them to turn their cameras on as I introduce them. We have very, very fortunate to have all of these panelists speaking with us today. I'd like to introduce first Dr. LaVerne Brown. Dr. LaVerne Brown is the director of the Resilience and Health Studies program at the NIH Office of Dietary Supplements, where she's interested in stimulating research on dietary supplements that act on protective pathways to promote resilience outcomes in diverse populations across the lifespan. We also have Dr. Susan Mitmesser. She is the Chief Science Officer at Pharmavite and a creative and dynamic scientist with nutritional biochemistry experience in various industries, academia, and clinical settings. She's a cross-functional team leader, providing scientific and technical expertise with a unique ability to communicate scientific findings to technical and non-technical audiences. A visionary in strategic research planning, implementation, and execution. Lastly, we welcome Dr. Abbie Smith-Ryan, Professor and Associate Chair for Research, Director and the Applied Physiology Laboratory, and Co-Director of the Human Performance Center Department of Exercise and Sports Science at University of North Carolina, Chapel Hill. She is serving as the Associate Chair for the Research Department for Exercise and Sports Science, and Abbie's journey in the realm of exercise physiology and sports nutrition has been driven by a profound passion to enhance health and the quality of life for individuals across diverse backgrounds with feasible and effective evidence-based approaches. Welcome, all three of you. Thank you so much for being here. So we're going to start with an initial polling question to get to know our audience a little bit. And that question is, what is your role in women's research and or research on products for women? We'll give you a moment to respond here so that our panelists can have a chance to know who we're speaking with and what topics may be particularly relevant to our audience today. Okay. Get your answers in now and we'll close the poll. Wonderful. So it looks like most of us here are from industry, but we do have representatives from academia as well as private funding sources of here. So industry is the majority, and I think that it'll be interesting to see how we can better create bridges and collaborate with academia and government to increase the breadth of resource funding that we have here. So thank you for your input on that. That'll help us in our discussion. Okay, so next, I'll start with our first question for our panelists. I'd like to get your opinion on, what you feel are the challenges, but also the advantages in funding women's health research and why this is an important topic for discussion today. So I'd like to start with LaVerne, please, if you have input on this.
Yeah, sure. Thank you. Thank you for that question. I think I'll start with the advantages. I don't know how many of us are aware that women, the study suggests that women actually use and consume dietary supplements more than men. And even if we're thinking about prenatal supplements, I think 90% of women who are expecting and are consuming prenatal supplements. And so there's a clear advantage there. There's a clear opportunity there for us to determine or drive funding in the direction of women's health, not just for maternal health, but across the lifespan. But the challenges are that there are a vast number of supplements out there. Like the numbers, I don't even think there is an official number representing the number of supplements that are out there right now. And so the challenges especially for an office like mine, the Office of Dietary Supplements, it's not just which supplement or which ingredient or which active do we pursue, but then the challenge is how could we prioritize our funding of dietary supplements research in such a way that we can impact a public health issue the greatest, right? And so the challenge for us is how do we prioritize all of the dietary supplements out there, all of the public health issues out there, and consider what we can do to advance public health by funding more dietary supplement research. And again, so if I'm leaning on that as being a challenge, and I have to say that, while we have these endless numbers of dietary supplements and ingredients, and we have these endless questions, like we want to know, are they effective? Are they safe? At what time should we take them? What's the appropriate dose? We have all of those questions, but then we don't have endless resources, right? And so we have to really take our time at my Office of Dietary Supplements at NIH, to really think about how to maximize the resources that we have to have the greatest impact.
Well said. So the advantage is that there's a clear need and desire for this knowledge, and the challenge is how do you prioritize those needs? And I'm sure we'll find that the priorities maybe slightly differ across fields, whether it's academia, industry, or government. I'll be interested to hear how you all prioritize that. So next, I'd love to hear from Susan what you feel the challenges and advantages are in funding women's health research.
I'm going to start with the challenges. I think we still have quite a ways to go to change our mindset in clinical research, but also basic research. And I'll give a real life example. Last year, so 2023, we were conducting a proof of concept study in an animal model. The research organization that we identified that was really skilled in the endpoint we wanted to measure discouraged us from including female rodents in the model. And the intended outcome, or the intended product, was for the totality of the population, not just males and females, the general population. And it gave me great pause. I was like, why am I having to fight to actually get female rodent models in this study? At the end of the day, we were able to do it, but it was really interesting that we didn't even have to change the number of the N of the population that we were studying. We split the population, but it was double the cost. And for me, I was just really, in the year 2023, I was really shocked that this still happens, and we have to fight to actually get basic research done in male and female models. So I think we have a ways to go. The advantages. I think one of the most profound things about females is we communicate differently. We thrive on community and empathy. And I think that we should talk differently about education and things like that to women than we do our male counterparts. Not better or worse, just different. And so I think what we find is that how you talk to the intended population of your product really makes a difference. And we find that women are empowered by empathy and community. And so we really need to lean in that. I don't think the Taylor Swift phenomenon is fake. I think it's real. And I think it just highlights how women thrive on community.
That's a great point, and something to consider. We talked about in the previous webinar on recruiting women for clinical studies. At the same time, we need to consider that as we prioritize what is it that women need in terms of closing that knowledge gap, and doing that needs assessment may be quite an important aspect of it. Abbie, I would love to hear from you. How do you perceive the challenges and advantages?
Yeah, and let me just quickly say thanks for having me, and for you guys for holding this. I'm grateful to be here, and I'll bring a nerdy academic perspective, as well as doing some work with industry. And I'm going to start with the advantages, and it speaks to some of what Susan said. And really, I think we're at this somewhat of a tipping point where women are having louder voices. There's this increased awareness. NIH has seen it. and really promoted the need and provided some resource with the Women's Health Initiative. And I'll come back to that in another question. But I've seen it both on the television side, there's this increased watching of women's sport, but also women are having this voice of we need more and want more. And so, it's hard to ignore that, which I think is a really great advantage. I think there are too many challenges, but a little bit beyond. So I do all human subjects clinical trials. And women are the best participants, and there's so many of them, meaning like they really want to participate. But there is a major lack of understanding of how to collect data in women. And it becomes a challenge on the funding side because you have a lot of reviewers that aren't sure how to do it, as well as a lot of when you think about publishing papers, a lot of reviewers that aren't sure of what those standards are. And then realizing that there can't be one model when you apply to a woman because of the different hormonal profiles as we transition across pregnancy and menopause. And so we need to come further to realize that there's just a few more steps and kind of ingredients that go into understanding and evaluating women. And there's not a standard currently. There's still a lot of bias standards in a way of, I'll give you one example that I can never forget is when I was submitting an IRB protocol to study women, and they came back and said, you must include childcare as a cost for participating. Like it was a negative that of course women are going to have to pay for childcare if they're going to come in for a research visit. And my head was like, well, so would men. Like, why is that just specific to women? And so I think we still have this biased view of women's role, and it impacts sometimes of how we approach them. And at the same time, trying to work around it. So, if you're studying a perimenopausal woman, yeah, they typically have a job, they are doing caretaking, but that doesn't mean we shouldn't study them. There's just some more things in place that we might need to shuffle. And then the last thing I'll say is it does take a little bit longer and a few more resources to study women, particularly when we think about hormones, and it's not just estrogen. And so really understanding what do we need to measure for the outcome, where those costs are. And then remember a lot, like right now our field is very much like, oh, it's not gold standard, therefore it doesn't have practice. When in reality, we would never say that for a male study. And so really thinking a lot of studies have translation. It may not be translatable depending on all of the things we're measuring. So it's really reevaluating our standards and having those questions.
Well said. Great insights. Thank you so much for that. I think at this point, with this introduction into the importance of this topic, the advantages and challenges, we do have another audience poll question because we want to know where our audience has been finding their funding. Have they been successful in any of these areas? So please tell us, audience, which sources of funding have been successful for you, and you can mark all that apply. So we'll see how the audience perceives this challenge. Okay. Okay, looks like we have our answers here. So many people are still working on it, still trying to get funding, putting in the effort, perhaps haven't quite succeeded yet. And many here I see are self-funding. So keep in mind our audiences looks like primarily industry. And so industry is funding a lot of these studies, which is interesting to know. Industry partnerships are an important source here in this audience, but we do see some government grants and investor funding coming through. So that's good to see that there is that collaboration there. And an example of crowdsourcing as well, which is quite interesting to see. I think that's maybe less common, at least for our audience here. So lots of different ways to access funding here, but we're seeing a need here to better understand how is it that we can really successfully obtain funding, as many people have reported they're still working on it. So let's go to the next question, having that insight. And I'll ask the the panelists, what are the sources of funding that you rely on, and how do you go about obtaining this funding? So we'll start with Susan again.
We rely on, I'll say, all sources of funding. We have internal resources of funding in which, I have to fight for all our research dollars and make the case as to why we want to do that. I'm super fortunate to work for an organization that believes in the foundation of scientific investigation. And we have a wide variety of ongoing research projects. The other key funding source is collaborators. So academic collaborators, ingredient suppliers. We've started to do this more in the recent past, is really identify ingredients that we love and that we really, really have a lot of the ingredient has a lot of scientific rigor, but we at Pharmavite think we can partner together for the greater good. And so we've really started to identify some of those key ingredient supplier partners. And it's been super fruitful. And we've been able to almost leapfrog some of the research that's currently published. So that's really exciting. We also rely on government grants. So we're a firm believer in ensuring that we're aligned with NIH funding resources and initiatives. And so we pay particular attention to those as well.
Great to hear. And I do see this trend where ingredient suppliers the onus is more on them. They're taking a lot more active effort to conduct studies themselves to provide to the brands that make the finished products. We certainly pay attention at Asterial to this topic. And so it's great to see that there's more openness to collaboration between the manufacturers of the bulk ingredients and the finished product. We can certainly accomplish more together. Thank you for that insight. And next, I would like to ask as well, Abbie, how do you lean on funding and what are some of the resources you've successfully used?
I mean, this is the $1 million question, so I was hoping to learn from Susan and LaVerne as well. But I mean, all of it. And as my role, like my livelihood is funding, and it is a big challenge, but definitely a bigger challenge for studying women because it does take a little bit more resources and takes a little bit longer. But to be helpful, I would say I've always taken kind of a fast and slow approach. So for instance, I've been successful in government funding, but it takes a lot longer. And I find that they want less. It's a kind of it's slower. It's a good amount of money. It just takes longer, which I'll speak to in a question coming up. And so some of the faster funding sources would be pilot funds, industry. They always want it done yesterday, so it moves a little bit faster. Been pretty successful with foundation. And right now there's a big push, you can see with commodities are all really supporting women's health research, and that also moves a little bit faster. And more recently was successful with an interesting crowdsource approach that we saw. And so that funding went really quickly, like funded within a couple of weeks, which is interesting. And there's more on a global scale. The ARPA-H was a recent one. It was a sprint for women's health. And the goal was to be more of a kind of a business model with very quick outcomes. And so my advice, particularly those in academia, is we shoot for everything. And just an interesting little story of I have a really fun project with American Diabetes Association right now. And I submitted a similar idea to a couple commodity boards and a couple NIH foundations or grants. And some of the comments were terrible. Like, you're the worst. It's not me personally. This is the worst idea. But then I got funded through ADA. And so I say that of, you just never know what they're looking for. Oftentimes they don't know what they're looking for. And so it's really saying, like, sometimes the same idea is not bad. You need to reformulate, but it's really taking and diversifying your funding, and that there is an option. And sometimes those small pots of money can give you a lot more. And so it really is staying kind of small, large, short, fast. All of those approaches can really help accelerate this area.
Great insight. So really maximizing and diversifying your portfolio in terms of funding resources to maximize success. Yeah, great. And LaVerne, I'm sure that your view on funding resources is a bit different as you are more on the giving side potentially, and there's this very specific structure. So I'll be interested to hear a little bit more about that from you.
Yeah, that's right. So it's interesting that we got these questions about funding and how, challenging it is to get funding, especially at NIH, or the process is so much slower. And you're right, we do have very specific processes in place, but we do have ways for you to access the funding, right? So, if there are links, there are web pages on the NIH page, that website that allows you to identify which sources of funding might work best for you. There are specific funding sources just for women's health. We have an Office of Research on Women's Health at NIH that has been really pushing like sex as a biological variable, the need for more female representation in clinical trials or even in animal studies, right? And so it's out there. I guess the suggestion would be to just take the time and seek out the different projects and opportunities that are available on the NIH website. Now, speaking specifically for the Office of Dietary Supplements, we actually don't fund our own studies. Our office is part of a larger division, which is a coordinating division. So our job is to coordinate with all of the other NIH institutes and centers in such a way that we make sure that they're considering dietary supplements as part of their funding opportunities. One of those opportunities that we're currently co-funding is with the Office of Research on Women's Health. There's this new White House initiative on women's health research. That new initiative is focused on any applications that want to better understand disease and health conditions that predominantly affect women. And this doesn't mean that the study has to just be all women. I think Susan kind of alluded to this. This means that the study can be men and women, but you want to have enough women in the study that you could be able to separate out the data and understand the data in such a way that you can align outcomes specific to women's health. And ODS is participating in this, in co-funding this initiative. And specifically, since this is the Women in Nutraceuticals webinar, I want to just highlight some of the areas where the Office of Dietary Supplements would be interested in receiving applications. So we would be interested in the role or the function of effects of dietary supplements and their ingredients on health optimization, disease risk reduction, prevention, or any related health outcomes in adolescent girls as well as women. We are also interested in understanding what are the micronutrient deficiencies that can impact women across the lifespans. What are the ideal doses, or what are the ideal study designs that could better allow us to promote women's health, or better allow us to understand how dietary supplements might align with promoting women's health. And then we also want to understand what are some of the dietary supplements or their ingredients in neurological development, cognitive function, stress-related disorders, and on and on. Again, I just want to reemphasize that while we don't fund our own studies and we do participate in co-funding studies, the key here is that you kind of have to understand you get two for the price of one. In other words, you would want to submit an application to a leading IC, an institute or NIH center that's also participating in this funding announcement. And then once you've been reviewed and accepted through that NIH institute or center. Then ODS, if there's a piece of your project that's relevant to ODS interests, then ODS will also contribute some co-funds to that project. And so I understand it's a little bit tricky, and that the process is a little bit longer, as Abbie mentioned, and that's because I just want to. It's not because in the case for NIH, it's not necessarily because we don't know what we're looking for. It's more that we're trying to design these funding opportunity announcements in a way that we could get the broadest reach. We don't want to leave out any ideas. We don't want to just limit the funding opportunities to our own thoughts. We want to make sure we're bringing in thoughts and ideas that we hadn't considered. So we want to make sure it's broad enough to do that, but at the same time, we want to make sure the language is narrow enough so that the researchers understand exactly what we're hoping to get out of the funding opportunities, but not just the researchers, the reviewers, right? We need to make sure the reviewers understand that, yes, for this project, for these applicants, we want as many women in the study as possible. Yes, for these applications, we want someone that's interested in facilitating the understanding of dietary supplements and women's health. And so it's a tricky dance that we all play, but I would like to suggest that I think the opportunities are out there, especially for women's health these days.
That is very encouraging to hear. And, I think when we consider the ways that we collaborate, for example, in industry with academia, we do something somewhat similar where we set our priorities. What are the questions that we would like to emphasize, but we like to leave it open to the experts, the researchers themselves, who bring in their expertise, their ideas, their methods that influence and give better structure and direction to our priorities and help to make it happen. So I think the key here is collaboration and some initiative and digging. Since the resources are on the website, it would actually be great to get a few links from you to share with our audience later to make sure that we all know exactly where to find those tools that you're talking about. Thank you for the wonderful insight there. So does anyone have anything else to add now that you've heard kind of everyone's resources? Any remarks just to finish off this question? Okay, I see that there's a link put up. Great. Okay, so we will share that link, thank you, with our audience later. And the next question is, what do you consider to be priorities in funding women's health research? So we heard the importance of setting priorities and communicating those clearly. It'll be interesting now, since we have representatives from government, industry, and academia, to hear how you think about those priorities. I think LaVerne touched on them already. Let's expand on that and see if we can find any kind of overlap there. So Abbie, I'll start with you. How do you think about priorities for women's health today?
Well, so my opinion is very biased, obviously, based on some of the work we do, but based on this space, I feel like one of the main priorities is really tangible and feasible ways that we can have direct translation to clinical care and education. And so like women in this space across the lifespan and really want more information, but there is this large data gap. And so what I'm saying is that we need studies that have direct outcomes pretty quickly, and that can impact that direct translational care. There's so much value in bench work and animal models, and we are so far behind on that as well. But I feel like right now, because there's this large gap, we need things that have these kind of direct applications to women right now, especially because a lot of physicians in clinical care, we don't know how to treat the women. And so now that I would say is a priority, as well as with some accelerated outcomes. So science does take a long time, but can we, and we're seeing that, like I mentioned with the sprint, the ARPA age, but can we create some studies that do have some direct outcomes? For a long time, this space was very much all around, and I'm thinking more in like general women, older women as they age, was really around hormone therapy, which is still very important. But particularly for this audience and in the work I do, a lot of women want to know what are other lifestyle and more like non-pharmaceutical ways to support their health. And I do feel like it is a little bit harder to have funding and find funding in that space and in healthy women. You know, a lot of times NIH makes sense are trying to find, and there's usually a disease connection, which makes a lot of sense. But how do we support and evaluate and prevent disease? And there's funding options there too. But I think right now there's a lot of women that we could have a big impact if in kind of that prevention, using things like lifestyle. So dietary supplements, ingredients, obviously exercise, sleep. What are ways that we can really help their health and quality of life right now, and then have that translation to clinical care? How do we get that education, not only to the women, but also to the clinicians? There's a big gap there based on when the people that are caring for us didn't have that training. Wasn't that education. And so the last thing I would say is there is, in my mind, a huge need for understanding diverse populations, both like ethnic differences, but also different socioeconomic statuses. And we're seeing that with all these GLP drugs, right? Like if you have funds, you have more access, and we really need to do better about how and what are feasible options to help health and quality of life of women, regardless of resource, and understanding kind of that ethnic and socioeconomic backgrounds.
Okay, great insights on priorities there. Yeah, so we want to make sure that we have actionable data, outcomes, results that will help a diverse group of women and underserved populations. LaVerne, anything to add, since you already talked about neurological development, stress, cognition, and other aspects that you considered priority? So can you expand on maybe how you think about these priorities, how they come to light, how you assess the needs?
Yeah, so my office has just started or just finished developing a strategic plan for the next several years. And we have these themes for which we have prioritized what we might consider opportunities for funding future research. One of the themes is population studies. As Abbie mentioned, we're interested in making sure we understanding a diverse group of individuals and across the lifespan, you know, age differences, socioeconomic status, race, ethnic differences. And so we have a population studies theme in our office where we want to make sure we're understanding those differences and how supplements might be consumed, how well supplements might work, whether or not you're exercising, et cetera, and how that might impact the effectiveness of a dietary supplement ingredient. But another thing we have is also methodology and resilience. And since I lead the Resilience and Health Studies program, I will shamelessly give more details on that priority area. And so with the Resilience and Health Studies program, we are interested in understanding not just the disease outcomes, as Abbie mentioned. We want to understand better a different marker for evaluating dietary supplements. Our belief is that, you know, we have all of these studies on dietary supplements and dietary ingredients that are not giving us the outcomes that we're expecting. And then we go back to the clinical trials and we think to ourselves, were the studies designed incorrectly? Is it really true that that supplement doesn't work, does not benefit our health outcomes? Or is it that maybe we're looking at the wrong outcome? Maybe dietary supplements are not intended to impact a disease outcome, which is the way we've been studying that, right? Maybe dietary supplements are intended to impact a protective pathway or resilience outcome. And so with the Resilience and Health Studies program, that's exactly what we're hoping to promote. We're hoping to provide some guidance on how to design a study so that you're actively, intentionally looking for resilience outcomes as opposed to disease outcomes. We are trying to identify what are those protective pathways that dietary supplements or dietary ingredients might be targeting that are different from the disease pathways, right? So we're not just saying we want to stop or block a disease pathway. We're saying, what if that risk was there? What if that, that condition was there? Is there a protective pathway somewhere that maybe dietary supplements act upon that could offset that condition or risk? And so that's one of our priority areas in our office, and we are really active in trying to get feedback from you all, from academia, from industry, on how to move forward with this. We have a workshop coming up soon, and because the key here is that we throw around this term resilience so often. What does it really mean? And then if we really understand what it means, how do you really measure it, right? How do you write up your grant applications and you're really saying that you're measuring resilience and not some disease outcome? And we want to make sure it's clear that when we're talking about resilience, we're not talking about, there might be some overlap with prevention, but it is not prevention. When we think of prevention, at least in my office and with the Resilience and Health Studies program, we're thinking that you're mitigating a risk, you're mitigating a disease, you're trying to prevent that disease. When we think of resilience, we think you're enhancing, you're improving the health of the entire system, right? And so it means that despite the fact that you can continue to have that risk, you can continue to maybe not upregulate, but maybe you have turned on some switch that has caused this disease pathway to be, initiated, right? But maybe there's a whole different pathway, protective pathway, that a dietary supplement could act upon that could offset any symptoms from that disease. So we think that sometimes there's some overlap in prevention and resilience, but it's not the same. We think that there's very different pathways, very different study designs, and that's what we like to collaborate with industry and academia in order to promote this concept a little more.
It is such a fascinating field, and we often at conferences and within industry think about exercise and nutrition and sleep as multi-system interventions, and using systems biology to look at the overall equilibrium and how that's disrupted. When we experience stressors, physiological stressors, environmental stressors, and looking at those indicators as a whole. So it'll be so interesting to see that develop. And as we start to define markers of resilience, that essentially the path, I suppose, will be that these will be indicators eventually, or surrogate endpoints, perhaps down the road as we learn more about what those pathways of resilience are. It's fascinating, and certainly an area to pay attention to within the dietary supplement industry. So thank you for that great insight. And again, you mentioned some resources and tools. I think we will have to gather those from you as well on that program. Susan, we'll end with you on this particular question before we proceed to our next question.
Mm-hmm. We always start with the consumer in mind. So that's really our genesis for what we do from a research standpoint. So we evaluate what are the needs of the specific consumer. And then we try to look at it from a population. So how can we have the broadest reach within the population, have the broadest impact? So on a population level. And then think about subpopulations. So how do you then narrow it down to a subpopulation that has a concern, and then all the way down to the individual. So it really helps us give breadth, because one of the values of being in industry is that you have a direct line to the consumer. We have skills to develop a product, put ingredients in a product in the delivery form that is best for the consumer. And so that direct line and outcome for the consumer is really important to us. But let me give you an example. So when we talk about population, a lot of women have sleep issues. So how can we impact sleep for women? Then when we look at subpopulation, let's say that woman is in menopause. So you have somebody that's struggling with sleep and is now in menopause. Okay, we're getting down to the subpopulation. Now let's say that same woman is on a statin or a vegan. So you're getting down to these very individual, the individual that has an issue, but now it's compounded with sleep, with menopause, with a diet change, with potentially a nutrient drug interaction. So we really look at our research priorities based on that, starting with the broad population and then narrowing it down to really niche populations or the niche individual that needs help. And how can we deliver that product directly to the consumer that needs that intervention?
Brilliant. So we've heard, we set priorities based on in industry, who our consumers are, who is our target audience. We have a very clear view of who that may be. And in academia, a lot of focus on translational outcomes that will actually make a difference to clinicians and patients. And then a great initiative on resilience and moving forward. How do we think about the role of dietary supplements? Now, having laid out these sort of ways of thinking about priorities, I think the $6 million question is, how can government, academia, and industry collaborate on aligning those priorities? And Dr. Brown, let's start with your thoughts on that question.
Yeah, that is the $1 million question, right? So my office has, some activities in the past in which we have promoted collaborations with industry and academia, and mostly it's been workshops. When we host workshops, we intentionally bring out folks from academia, from industry, to help to give us some guidance, to give us, through your presentations, through your engagement, we learn from you. We learn better how to write funding opportunities, for instance. We learn better what the key topics are, what should be priorities. So that's one way in which my office has been attempting to enhance collaborations with academia and industry. Another way is through our seminar series. Not only do we invite academics and industry partners to present seminars, but we invite you to tune into the seminars. And then there's always a question answer session. And through those question answers, through your engagement, again, we are learning, we are taking notes and understanding what the priorities are. But I do think we can do better, right? I do think there are more opportunities out there. So I consider this one of those opportunities where I can hear from you all and understand, what are the priorities? Are we getting it right? Do we need to shift or think differently about this topic area? And so I'm tuned in.
Beautiful. That's wonderful. Thank you so much. Susan, how do you see our collaboration working out? Where would you like to see us going with this?
We need to coordinate efforts to really take advantage of the resources, dollars, and people that are available. If we really want to move the needle and make up for lost time, we have to coordinate efforts. And it takes all three of us: industry, government, academia. We have to coordinate. So I really am a proponent. Let's get tactical. Let's develop a consortium to develop a roadmap to identify the gaps. I bet there's more we agree on than not. So let's establish this consortium that helps us guide and identify gaps and coordinate our resources. I think that is a great start. I love the idea of getting knowledge and sharing these workshops. I think that needs to be coupled with tactical execution on moving and coordinating our efforts to take advantage of the resources.
Wow, this is making me want to get up and go for a run. Okay, Abbie, how about you? How do you feel?
Well, I'm jazzed now. We are all on the same page. I would agree absolutely with both of what they said. I think I would add some transparency and of what those outcomes are. Like, as a researcher applying to grants, we all have these great ideas, but I want to create a study that's going to answer a question that someone wants to be answered. And so kind of a little bit more transparency about what are some key targets, or, now we see these funding sources of women's health. Okay, well, that means a lot of things. And so just a bit more transparency on where those goals are from industry, from NIH, from all, and then we can create those studies that have more target. And then I'll say this because it's the WINS group, and as a female academic, and dietary supplements and exercise is a very male-dominated space. And you find that, and it's a very competitive space. And so I think we need to create an environment that is building up young scientists and industry and leaders like you guys are trying to do, and do it in a way that does bring us together. So it goes back to what Susan says of we need to be sharing the data and not all doing the same study in different places. And I think there's an element of women that we all have a bit more imposter syndrome. So do men, but it forces us to kind of figure it out on our own, or drop out and say, oh, I don't have what it takes, or, there is a lot of rejection. And so I think building this environment that we are all helping each other and celebrating each other can really move the needle in this space. And I feel like we've done a little bit of the opposite right now, whereas, oh, it's not the right method, or it's not have enough impact, or it's not done correctly, where I think we as women need to stand up and say, let's help, and let's use what we know and our failures to really help not only those behind us, but I've learned so much today too. We're all just still trying to figure it out. And so building that community together will really help this space as well.
Well said. And I think with that, I would like to thank all our panelists and pass it on to Mariko, who will manage our Q&A session. Thank you all so much for your great insights and passion. I think we're all fired up now. Okay, Mariko, on to you.
I was going to say, what an incredible webinar it's been so far, and being sort of outside and listening in, there's so much content, and how engaging this whole topic has been. So thank you, Susan, LaVerne, and Abbie for being part of it. I think before moving on to the question and answer, it's probably good to summarize some of the points that have been addressed. There has been a lot, but ultimately we've established the main challenges of funding women's health research. Of course, this typically is around the cost of running research, along with the particular ingredients or issues that are to be addressed, and how that can translate to public health concerns as well. But at the same time, there are also advantages, which can also be about not generalizing to the male population anymore, and that there will be female-centric studies, so we can really understand how an ingredient or an outcome can benefit a certain outcome as well. Now, we've also identified that the main resources or sources of funding are typically from government grants and industry partnerships. And there are multiple ways of obtaining this. So whether that's by crowdsourcing, or collaborating with suppliers and researchers, or of course having a research budget, which is important from Susan's perspective. But there are multiple ways of obtaining it. And I think based on the audience, where we are a lot of industry peers, it's really about that collaboration piece. And lastly, probably the most important aspect is how we all collaborate together, from government, academics, as well as industry. And the main priority is to always have the female consumer in mind. And I love that quote by Susan, because it really hits the nail there. And ultimately, we need to conduct more research on the female physiology, because we want to try and translate that into real outcomes. So with that, I will move on to the question and answer section. So thank you all for all those that have sent those questions in. I will start with Tracy's question to begin with. So this is directed at Dr. Brown. Now, what can industry do better to work with your office to get more research conducted on women or by women?
Yeah, I think opportunities like this. So I heard Susan mention the consortium. And in fact, I think that's a fabulous idea. Oftentimes, not just my office, but some of the offices and institutes and centers across NIH, we have the workshops. That's when we do the most engagement, or we attend conferences, and when we're attending conferences, we're talking to the folks in industry. We're talking to the organizations, any opportunity to partner with folks outside of NIH. That's our goal. When we step outside of the office, our goal is to find opportunities to collaborate and to learn from you all. But we can work on that. I think I'm here to learn from you all. Like, what can we do better to enhance those partnerships, especially with industry? Because I think and I'm speaking for myself here, I think what NIH does very good is partner with academia. I think we do have a challenge with partnering with industry, and I would love to see that enhanced and in the right way, right? And so I'm all ears. If you have suggestions, I'm happy to take it back to leadership. But I can just tell you what we're currently doing, and that's the workshops and conferences and seminars, etc.
And I'm sure with that, we can somehow put on the editor's note some of the links according to the NIH on how we can try and get in contact with you. And all the answers and questions can always be addressed. And there is a lot of information in the resource panel that we'll put out as well. So you can all sort of go on there and look into. Now, the next question is from Lena. One of the challenges we face with NIH SBIR funding is that NIH or NCCIH does not have its own study section. The ad hoc reviewers come from traditional pharma or biotech areas who do not understand and sometimes have conflicting views of the industry. How can we change this? That might be, again, maybe more of a directional question towards you, LaVerne. If anyone else has any answers to that, feel free to answer as well.
Yeah, so it varies. Sometimes we do request specific study sections as reviewers, and sometimes we just hope that we have been very clear in the NOFO and the funding opportunity announcement of what we're looking for. Oftentimes, when we're selecting reviewers or working with our review officers on who to pick, we have in mind that they will understand the objectives. They will understand what we're trying to achieve with the funding opportunity, and they would know all of the intricacies and the nuances that have to be considered in funding the right projects. But the process is ever improving. I can't say that there's not still room for improvement, but we're getting there. And I think feedback from you all is certainly very helpful.
Absolutely. Thank you for that. Now a question potentially for Abbie from Dr. Rohit Singh. Please enlighten us on how you see the CROs conducting preclinical, clinical, and BABE studies that can get funding and support from sponsor companies.
I'm not sure I'm the best person for that. Yeah, I mean, yeah, I don't have a great answer. I guess I don't specifically for how to use the data. Let me closer look at the question. Get funding to support from sponsor companies. Maybe that's a question better for Susan or LaVerne.
Yeah, I think maybe from an industry perspective, especially from a global strategic side of things.
Yeah, I'll just add that as an industry leader, we have a product donation program. I would say that's a great place to start. If we have a product that's in market, we donate product and matching placebo, which is many times unheard of in nutraceuticals. Reach out to us. We have a very robust program in which we'll donate the product and we'll help with the grant writing and things like that. So we do have a pretty prolific support system for getting and helping researchers do their investigation. That's a great place to start. Another place to start is really at conferences. We speak at conferences, we're presenting posters and our own research. And so reach out. It's a great networking opportunity. And really what it's going to come down to, if you want industry funding, is synergy. There has to be a match in what we what our industry is, our strategic priorities and your academic priorities. And so I think when we find that synergy, it's a pretty easy lift for us from the standpoint of, okay, yes, this is here. Let's 1 + 1 now equals 3. Let's make this happen.
Yeah, absolutely. And I believe that the time is running out, unfortunately. I think the discussion, I'm glad that we've actually overrun with the discussion aspect because there's so much content. I do want to say, again, a special thank you to LaVerne, Susan, and Abbie for coming into this webinar. And I do hope that everyone in the audience have gained something out of it, and to share amongst all your colleagues, your peers, your friends, and to really be engaged with the WIN committee, because we will be putting up more newsletters as well. So make sure to keep in tune with that. And there's all the upcoming webinars within the Science and Mentorship Program as well. So thank you all for tuning in, and hopefully see you again next time.